If you have hearing loss, you've probably wondered this at least one time. Will there ever actually be a way to cure hearing loss? You may have seen headlines about stem cells, gene therapy, or drugs that regrow the inner hair cells. Today I want to walk you through what's actually happening in hearing loss research, what's promising, what's misunderstood, and what's realistic right now. Why hearing loss is so hard to fix. To understand why restoring hearing is so challenging, you first need to understand what usually causes hearing loss. In most cases, it's damage to inner ear hair cells or the auditory nerve, the tiny structures that translate sound waves into signals your brain can understand. Humans don't naturally regenerate these cells. Once they're gone, the brain simply stops receiving clear sound information. That's why hearing aids don't fix hearing. They compensate for missing input. They amplify sounds, clarify speech, and improve communication, but they don't restore the damaged biological structures themselves. So the big scientific question has been, can we repair or replace those damaged cells? And if so, how? Stem cell therapy, promise versus reality. Stem cells are often mentioned as a potential solution, and for good reason. In theory, stem cells could be guided to become new inner ear hair cells. In laboratory and animal studies, researchers have successfully regenerated hair cell-like structures. That's exciting. It proves the concept is biologically possible. But here's the reality. Creating cells is only part of the challenge. Those new cells must connect correctly to the auditory nerve, send accurate signals to the brain function consistently and safely long-term. Even if you could grow perfect hair cells, connecting them properly and ensuring they transmit sound without distortion is an entirely different problem. Translating success in a petri dish or a mouse ear into reliable human hearing restoration is extraordinarily complex. So while stem cell research is promising, it's still in the early stages. It may take years or even decades before it could lead to treatments for humans. Gene therapy, very targeted, very early. Gene therapy is another area getting attention, especially for genetic hearing loss. In very specific cases, researchers are exploring whether replacing or modifying faulty genes could prevent, slow, or even reverse certain types of hereditary hearing loss. Early human trials are underway, mostly focusing on rare genetic conditions in children. However, gene therapy is highly targeted. It is not a universal fix for age-related or noise-induced hearing loss, which is far more common. Each gene therapy approach has to be customized for the exact mutation and condition it targets. While this research is groundbreaking, it's still experimental. For most people with typical hearing loss from aging or loud environments, gene therapy is not currently applicable. Drug therapies and regenerative medications. You may have heard about drugs designed to regrow hair cells. Several pharmaceutical companies have explored this approach. Some early trials showed modest biological effects, like stimulating partial regeneration of inner ear structures. That's a big scientific step. But so far, no drug has reliably restored functional hearing in humans. Some trials were discontinued due to safety concerns or lack of effectiveness, while others are still ongoing and being refined. This area of research teaches us something important. Learning is happening fast, but learning does not always equal immediate treatment. We are discovering the biology of hearing in more detail than ever, but turning that knowledge into real-world cures is extremely difficult. Why you see so many headlines? Research headlines often sound more definitive than the data actually is. Words like breakthrough cure or restoration grab attention, but they rarely reflect what is clinically available today. For example, a news article might report that a gene therapy cures hearing loss in mice. That's true. In mice. Translating that to humans is a completely different challenge, and most treatments are years away if they ever reach wide use. Hope is important. It drives funding, awareness, and interest in research. But clarity is even more important. Understanding what is realistic today versus what is still experimental helps manage expectations and keeps patients informed. What actually helps people today? While a universal cure doesn't exist yet, there are proven tools that make a real difference today. Hearing aids amplify sounds and improve communication, personalized for each ear. Cochlear implants bypass damaged hair cells and directly stimulate the auditory nerve in severe cases. Assistive listening devices help in specific situations like classrooms, theaters, or meetings. Communication strategies, techniques such as lip reading, situational awareness, and turn-taking in conversation. Early intervention, detecting hearing loss early and using these tools helps prevent cognitive strain and social isolation. Using these methods doesn't mean you're giving up on future treatments. They protect your brain and quality of life while science continues to advance. The importance of protecting hearing. Even as researchers chase cures, prevention remains critical. Once hair cells or auditory nerve fibers are lost, they don't grow back naturally. That's why protecting your hearing is so important. Avoid prolonged exposure to loud sounds, headphones, concerts, power tools. Use ear protection in noisy environments, earplugs or noise-canceling devices. Monitor your hearing regularly. Early detection can slow progression. Maintain overall health. Cardiovascular and metabolic health can influence hearing. Protecting what you still have is far easier than trying to restore it later. Cognitive impact of hearing loss. Hearing loss doesn't just affect your ears, it affects your brain. Reduced auditory input can lead to cognitive strain, difficulty in communication, and even social withdrawal. Studies show untreated hearing loss is associated with accelerated cognitive decline. By using hearing aids or other assistive strategies, you maintain brain engagement, which is just as important as hearing the sounds themselves. Even if future regenerative treatments become available, protecting your cognitive function in the meantime is crucial. How research is moving forward. Science is progressing on multiple fronts: stem cells, gene therapy, and drug development. Researchers are also exploring neuroprosthetics, devices that can interface more directly with the auditory nerve or brain to restore hearing. Advances in genetics, molecular biology, and regenerative medicine all contribute to this progress. But realistic timelines are still years away, and success in animals does not guarantee human outcomes. The good news is that the foundation of understanding is growing faster than ever, making future breakthroughs more likely than at any point in history. Balancing hope with reality. The takeaway is clear. We are not yet at a point where we can promise a cure for hearing loss. But that doesn't mean nothing is happening. Hope and awareness are valuable, but informed decisions matter even more. Protect your hearing, explore current solutions, and stay up to date on research. When the day comes that a stem cell therapy, gene therapy, or drug can truly restore hearing, you'll be ready to benefit, and your brain will be protected until that breakthrough arrives. Will hearing restoration happen someday? Possibly, and the research is definitely worth following. But until then, protecting your hearing and supporting your brain is the most powerful thing you can do. Your hearing matters today and for the future.